Good evening, everybody. My name is Emma Carroll. I am in English 313010, and this is my field-based research project or project number 4. So amongst the different discourse communities, many different genres of information are used, written, and discussed. Each discourse community has its own preferred and common genres that may be used more often than others. This field-based research paper and presentation will be discussing the different genres amongst the general public health community, and then diving a little bit deeper into a more specific public health career like a physician's assistant, also known as a PA. For this field-based research assignment, I chose 2 different interviewees, but also talked small details with one more other interviewee on one specific genre. First, I chose Monique Oldfield, the public health librarian at Wayne State University. Monique has lots of experience with different genres and information in the public health community and has successfully helped me with a previous project for this class, so I decided to present my interview questions to her for this project as well, with confidence in receiving useful resources and different informational genres in my field of research. Secondly, I decided to narrow down the public health community to a more specific profession inside of the public health community. Corinne Gratzen, a personal acquaintance of mine, is a physician's assistant or a PA, as well as an assistant professor and clinical coordinator for the PA program at Wayne State University. Narrowing down the very broad public health community will allow more specific and targeted information and genres when it comes to a professional career in the public health community, such as a PA, a dentist, and other health and human services. Lastly, I discussed one certain genre with Joe Alamat, DDS, MD, who is the oral surgeon and maxillofacial surgeon that I work for. I chose to interview him because he is actively involved in working in the public health community as a surgeon, so he is up to date on the different forms and genres, as well as uses the type of genre I interviewed him about, which is a patient medical history chart or electronic health record. Overall, the interviewees provided this research paper with common and popular genres in public health and other health communities. The most common genres consisted of peer-reviewed journals, electronic health records, and textbook, which will be identified and discussed throughout the rest of this paper. EHRs are confidential between patient and care provider. However, they have all of the patient's past medical history and problems, current medications, treatments, progress notes, plans, and more. Peer-reviewed journals are very common amongst most discourse communities, especially in the health community, where medical findings are written about in order to be shared amongst the community for educational purposes. Peer reviewing ensures that the journal or article was reviewed by a panel who verifies the credibility of all the research done and the authors. Textbooks are also another form of information with the main goal of educating the reader. Textbooks require accurate and credible information along with citations from the sources its authors used and reviewed before publishing. These 3 genres are also considered the most professional and have extremely wide range of educational topics from environmental health to vaccines and chronic disease, all while giving readers trusted resources to learn from. However, non-peer-reviewed journals were discussed as controversial and disliked due to the uncertainty that the information is accurate, original, and trustworthy. It may not have even been researched and may just be utterly untrue. However, some still get posted online, so it is important to check credibility before accessing them. Most genres are accessible by the public, except for a lot of electronic health records through online libraries and regular libraries, classrooms, and more. The procedures that have been used to collect the data have majorly been over email, messaging, and a small amount of face-to-face discussion. As I don't often have access to the campus, I emailed Monique my list of interview questions, as she also has lots of online resources to refer me to. Corinne, I just sent a text message to due to our relationship being more personal than professional. And as for my boss, the oral surgeon, I was able to discuss with him in person and ask any questions due to being in his office multiple times per week. After further discussion and questioning with the interviewees for this paper, different parts of each genre have been acknowledged and considered. Textbooks always include the authors, publishers, and the publishing date for credibility and verification of it being up to date on the topic of the textbook. Table of contents in the beginning of the textbook allows the reader to easily navigate through the book to find information on a more specific topic. Seeing as the main purpose of a textbook is education, the reader will find bolded words throughout the text which are defined on the side, as they might not be well-known words. Pictures and diagrams will be in textbooks for visual learning opportunities and data or statistics. Practice problems are usually included as well for the reader to master their knowledge, and citations from other sources will also be inserted where needed in order to avoid plagiarism and assert credibility. Electronic health records always have the name and age of the patient along with their home address, phone number, and email address for contact information. Contact information is a necessity in order to reach the patient for scheduling appointments, calling back on test results, references to other doctors, billing, and more. Another section includes the patient's past medical history and any significant health problems or events such as major surgeries or diagnoses like cancer or cardiovascular disease, for examples. Current medications the patient is taking are also in their electronic health record for healthcare providers to be aware of any medications for health conditions the patient might have, along with medications that could be potentially reactive with other medications or treatments. Progress notes and further treatments can also be found in electronic health records, as well as to reflect any progress after treatments and future treatments that might be in the patient's best interest. Lastly, peer-reviewed journals always have an abstract section before the actual article that gives a quick summary about the article itself before reading the entire article or journal. This can be very helpful during research when trying to find a credible source on a very certain topic without having to actually read the entire article. These journals will include footnotes at the end of the article, along with citations of any and every source that the author used throughout the writing process to avoid plagiarism and ensure credibility. Many will also include charts, diagrams, and tables as evidence for statistics or raw data that supports the article's topic. As many students and health professionals know, textbooks are a largely common source of education of the topic that the textbook is written on. The main purpose for them is to educate with accurate, credible, and up-to-date information to whomever is reading it. It is to be written in a professional manner with no uncertainty or disreputable wording or information. On the other side of the learning, many teachers and professors use textbook as a guide for their classes and courses. The textbook provides information that can shape a teacher's lecture and provide practice questions, which allow the readers to become more confident with the material and more knowledgeable. Electronic health records are used by every doctor's office and hospital so that any healthcare provider can access the patient's medical history easily. Patients can update their medical provider with any changes to their medical history, and doctors can send records to other doctors if needed. This allows for quick and easy access to important information on a patient when it comes to testing, diagnosing, medication, and other treatment options. With it being electronic or virtual, it doesn't allow for misplacement like a piece of paper. Storage and organization of electronic health records are also much more convenient than having to hand search through charts and files for a patient, especially in the case of an emergency. Peer-reviewed journals are the most common way that health professionals can share information, ideas, experiments, and more. These journals must be original and credible in a way that they are providing useful information and contributing to their discourse community. The journals are reviewed by a panel or committee and either approved or denied, as some journals are not seen as fit to publish. The main purpose of these journals is to provide other health professionals with other data and information to expand educational outcomes and knowledge, as well as allowing anyone in the general population who has an interest in that topic access them for their own further learning. Peer-reviewed journals have a similar main goal to textbooks, which consists of expanding the knowledge of the reader and including definitions, other source citations, visual diagrams, and information on a specific topic. After having conversations with my interviewees, I have learned a lot about different genres of the public health discourse community. As a student, I would have to agree that textbooks and peer-reviewed journals are the most resourceful and useful when it comes to learning about specific topics, such as how diuretics block sodium channels in the kidneys, all the way to how expensive chronic diseases are annually. As a surgical assistant, most of medical care and procedures would not be possible without electronic health records, and it would be extremely stressful to keep track of everything on a piece of paper and then have to keep track of where it is. I agree with my interviewees that these three genres are very helpful and informative, seeing as though I have used all of them, especially textbooks and peer-reviewed journals for more classes than just this one. Thank you for listening to my presentation and have a good night.